I'll tell you exactly what I would do if I was turning 65 today in 2025. I would, without a shadow of a doubt, have my original Medicare A and B, and then I'd have a Medicare Supplement plan along with a prescription Part D plan to fill in the gaps that original Medicare leaves you with. Hi, my name is Mark Pripp. I've been helping people understand and find Medicare plans for over 15 years. And a common thought that I always have is, what would I do today if I was on a Medicare? What plan would I choose and how would I do it? Based on everything I know and based on everything I've seen. So I'm going to give you a little insight to all these years of experience and show you why exactly I would do this, okay? So for the last 15 years, we've helped thousands of people. That means people call us all the time. They're brand new to Medicare. Hey, I turned 65. I'm coming off of a work plan, group health insurance, or I have an individual plan. What do I do? This has been a very rinse and repeat conversation. Okay, so you're new to Medicare, you're turning 65, you have two options. Get your Medicare A and B enrollment done, so now you have your Medicare claim number. And then you're going to pick a plan. You're going to either pick Medicare Advantage plan or you're going to pick Medicare Supplement. And this conversation was so simple for most of the last 15 years. It was basically went something like this. Medicare Advantage is lower cost per month. Sometimes most of the plans have a zero premium. That's because they're subsidized by the government. The government is paying the insurance company, therefore they can offer you a plan for zero premium. It's got your medical in there. It's got dental. Some of them have vision. And it's got your prescription drug benefit. That's kind of a roundabout way that we would go about it. So you have option A would be Medicare Advantage. Option B would be original Medicare with a supplement. You pay a higher premium per month. But then when you use the plan, like doctors and hospitals and testing, you generally don't pay any out-of-pocket costs because your original Medicare with that Medicare Supplement plan pays all the costs for you. So when you lay the two side by side, Medicare Advantage is very popular. It's also pushed very heavily by insurance companies. You share in more of the cost. They have more control over you because some plans require referrals. Most plans require prior authorization. That means before you can have testing or care or certain medical care done, the insurance company has to approve that care before you can actually do that. With Medicare Supplement, that's not the case. So it was very easy for someone to say, I like the Medicare Advantage plan because I'm healthy, right? Everybody's healthy when they get a plan and they don't think they'll use it. That's a conversation for another day. I'm healthy, I'll take the Medicare Advantage plan. I don't see spending the money on a Medicare Supplement as being worthwhile. Okay, great. So you've picked a Medicare Advantage plan. Now, what we had seen for many years, year in and year out, was that Medicare Advantage was really consistent. Each year, you saw very little changes. You saw very few people losing their plan because a Medicare Advantage company can terminate your plan during the annual election period once per year. Most people don't realize that Medicare Advantage is technically 12-month contract. So if that insurance company has any financial problems in paying claims for the group of people that you're a part of, say in this county or in this state, and they are not profitable and they're losing money, come that annual election period, they could just get rid of your plan and you're without a plan and you have to go find a new one. So historically, we have seen very little of that. Medicare Advantage was just kind of even keel, right? Well, then came the 2024 annual election period. And what happened was anytime there's a new administration in the White House, they have 4 years that they're there, as we all know. These companies are heavily dependent on a reimbursement rate. That means that CMS, the Centers for Medicare and Medicaid Services, every year tell the insurance companies how much they're going to pay them on behalf of all the members that they're servicing. Because again, with Medicare Advantage, You are basically giving up your original Medicare benefits. That insurance company is now administering the whole plan. Now, you're still enrolled in Medicare A and B, but all of your care and coordination and service and network comes through the insurance company. So every year, the insurance companies are sitting around on pins and needles waiting to hear what the reimbursement rate is going to be for the new year. Obviously, all of these companies submit their claim information. They have actuarial people crunching the numbers and saying, we're spending this much on medical care, we need this much in premium. So when 2024 came, we saw for the first time unprecedented plans being canceled. I'm talking about millions of people coming into the 2024 annual election period. And what happened was the administration that was previously in office was not reimbursing the companies at a high enough rate. So the companies were ending up paying out more than they were receiving. So what's one way to reduce a loss is you cut it off. You get rid of it. So that's what was happening is that for the first time really ever, of course, 2023 had a little bit of this. I can think back to, I think 2014, 2016 had a little bit of disruption. But 2024 really showed us the true colors of Medicare Advantage. So as I mentioned, millions of people lost their plan. They had to go back to the marketplace and pick another plan. The second wave of disruption came, where the second way a company is going to manage medical costs is by unprofitable medical providers. So we then started to see the plan terminations kind of quiet down, but then all of these insurance companies were now cutting large physician groups out of their network. We're hearing about hospitals being removed, large doctor groups being removed, because that's another way for them to save money. So I'm telling you all of this to say that it's not a black and white conversation anymore. More and more now I'm saying if you're looking at Medicare Advantage, you better be careful, because these companies are very, very sensitive to their medical loss ratio, and rightfully so. So if you get on a plan and the company is not receiving enough reimbursement from the federal government, you're going to have a couple things happen. You can lose your plan. They can change your benefits, increase your copays, eliminate services. I think in 2026, we're going to see a lot of the freebie stuff going away. I did a video earlier in the year kind of calling out Medicare Advantage plans because they attract people with these, free dental, free vision, free medical rides to your doctor. Some will even give you like a grocery allowance to buy healthy foods. All of those are really helpful things to people in everyday life. But they simply cannot sustain how big and attractive they've made these Medicare Advantage plans with all of these different free benefits. It costs money. So the first things that are going to go are going to most likely be all of these dental, vision, medical transportation or grocery benefits. You might see deductible on your prescription drugs higher than ever. So I would caution people today, if I was turning 65 today, knowing all that I know, I would hands down say Medicare Supplement. And here's the reason why. Everything that I just listed to you about changes, about plan cancels, about network changes, about reimbursement rate, everything I just listed, none of that applies to Medicare Supplement. None of it, okay? When you're on a Medicare Supplement plan, you have your original Medicare Part A and Medicare Part B. That is paying a bulk of your medical care for you. You can use any doctor or hospital that is in the original Medicare network, which is upwards of 96% of all providers and hospitals in the United States. You do not have to deal with referrals. You do not have to stick inside of an insurance company network like you do with Medicare Advantage. You just have to ensure that you're going to a doctor that is in the original Medicare network, which again is just about everyone. So no plan changes on Medicare Supplement, no network disputes. You won't receive a letter saying your doctors don't take your Medicare Supplement anymore. That does not exist. You will not receive a letter that your plan is being terminated. As long as you pay that Medicare Supplement premium, that plan is going to be with you for the rest of your life. There are safeguards and laws that ensure that that's the case. So Medicare Supplement, yes, carries a monthly premium. You may be in a state where you're looking at Plan N, maybe it's $120 a month for a 65-year-old. Maybe you're in the state of Florida, which is more expensive. Maybe it's $230 a month. Maybe you're in California and it's more. Maybe you're in Iowa. It could be $100 a month. So I want to really encourage you to think about what you're getting. The Medicare Advantage is very appealing because it's a zero monthly premium. You have all your benefits tied into one. Everything is covered. However, I cannot emphasize to you enough how many moving parts are happening behind the scenes with Medicare Advantage. It's literally this rocky ride on this rocky boat. Medicare Advantage comes with a strict rule book, okay? If you enroll in Medicare Advantage, here's the rules that you have to live by with Medicare Advantage. Are you okay knowing your plan could cancel during the annual election period? Are you okay changing doctors if they terminate your doctors? Are you okay switching prescription drugs because they've changed that? Are you okay with referrals? Are you okay staying within the insurance company network? Are you okay changing your primary care doctor if they remove your primary care doctor from network, which, by the way, happens all of the time? So if you think through it, I just listed a lot of things that you have to play by those rules. Can you live with all of those moving parts? Or would you rather just pay a monthly premium for Medicare Supplement and be spared from all of that? Again, Medicare Supplement is like a Cadillac, a brand new Cadillac. Yes, you pay a car payment or a premium, but anytime that Cadillac breaks down, the warranty covers everything. You have warranty for life, you have service for life. You're just paying your premium per month like a car payment. And that warranty is covering everything for you. Medicare Advantage is like a Dave Ramsey theory, right? It's a car that's paid for. It's wonderful that it's paid for. You don't have a car payment. But every time something happens to that car or changes or breaks, you have to fix it. You have to drive it to the mechanic. You have to pay for it. So it's more hands-on. So again, I've rambled a lot. I've seen a lot. I've talked to a lot of people. I've worked with a lot of clients. And quite frankly, the comparison between Medicare Supplement and Medicare Advantage, it's not as simple as it was at 3 or 4, 5, 6 years ago. It's just not. I have a guilty conscience now, just knowing when someone goes on a Medicare Advantage, I'm just thinking, I hope that this works long-term for them. Because again, the medical loss ratio and the reimbursement rate is so tedious and sensitive on a Medicare Advantage, it may not always be the case. The other thing I'll point out is that if you do enroll in a Medicare Advantage plan when you first turn age 65, that's your initial enrollment period. That means that you can go on Medicare Supplement without any health questions asked. You are guaranteed to get on a Medicare Supplement no matter how bad your health is. On Medicare Advantage, you're always guaranteed on that. That is not applicable. But after the first 12 months passes that you've been on Medicare, and let's say you're on a Medicare Advantage plan for a year or two, and something happens and you're like, I hate this plan, I want a Medicare Supplement. Now that you've passed your initial enrollment period and now you want to go to that Medicare Supplement plan, you will now be subject to medical underwriting. That means in order to leave that Medicare Advantage plan and go to that Medicare Supplement, you will most likely have to go through medical underwriting and qualify and be approved before you can do that. That is probably the second biggest surprise that I hear from people. They had no idea that if they just chose the Medicare Advantage while they are, the first year or two while they're healthy and then want to go to Medigap, they had no idea that there was a possibility that they could be rejected or denied that Medicare Supplement plan based on their health history at that time. So that's something to be very aware of when you're at a crossroads, when you're brand new to Medicare, looking at both avenues, is keep in mind that you have basically a guarantee into that supplement when you first become eligible, and that guaranteed eligibility will end after that year that you're on original Medicare. In 2025, I would absolutely, if I could afford the monthly premium, without a shadow of a doubt, I would pick probably Medicare Supplement Plan G or Medicare Supplement Plan N, and I would forget about all the other noise, all the other chaos that's coming from the industry and the advertising you're being inundated with. If you can't afford a Medicare supplement, I would highly recommend you still consider and crunch the numbers and look at the high deductible Medicare Supplement Plan G. Reason is that with high deductible Plan G, you still have all of the same features and benefits that you do with standard Plan G. You just have a deductible that's around $2,700 for 2025. That comes into the picture with high deductible Plan G. The difference is the high deductible Plan G premiums are going to be substantially lower than the standard Plan G. I'm talking about $40, $50, maybe $60 a month for the high deductible G. And as I listed earlier, maybe $125, $130, $150. Some states maybe, $250 for Plan G. So I would highly recommend you do the math on Plan G and Plan N and high deductible Plan G in terms of annual premium, all of the features and benefits that you're going to receive from one of those three plans, and compare it to Medicare Advantage. So before you jump off the cliff onto Medicare Advantage, look at the high deductible Plan G, significantly lower per month, and gives you all of that freedom and flexibility. You can travel, you can see specialty facilities anywhere in the country. You can go to Mayo Clinic, you can go to Shands, you name it, with a Medicare supplement plan. Medicare Advantage is going to have a lot of network regulation and may or may not let you see some of those world-class healthcare facilities that you could see with a Medicare supplement plan. If you have questions, comment below, give us a call. We'd be happy to help. Hope that it helps you make a better decision on your Medicare journey. Thanks for watching.